Welcome back to Wellness Lenses. Today, I'm going to explain the complicated world of social anxiety versus agoraphobia. Not only will you have a better understanding of these conditions, but you'll also have learned useful things that you can use to help yourself or someone you care about. Let's start by talking about social anxiety. People with this disorder, which is also called social phobia, are very afraid of being in public places where they might be judged or embarrassed. It's like someone is shining a light on you, even when you really want to blend in. People with social anxiety often worry too much before social events. They tremble, sweat, and have a fast heartbeat. They may also avoid social gatherings altogether. Cognitive behavioral therapy, or CBT, works, as shown by many studies like the one by Hoffman that was published in the Journal of Clinical Psychology, cited in the description box. Let's talk about agoraphobia next. Agoraphobia is the fear of being in places or situations from which it might be hard or embarrassing to get away. This makes people avoid places or situations that might cause panic attacks. Some agoraphobia symptoms, like being afraid of open spaces, public transportation, or even leaving the house, can be very severe. Studies, like the one published by Choi in the Archives of General Psychiatry, also cited below, show that medication and therapy, like exposure therapy, can help people with agoraphobia. Let us now look more closely at how social anxiety and agoraphobia are different. These differences are very important for understanding the problems that people with each of these anxiety disorders face. Number 1. Triggering situations. People with social anxiety are usually afraid of being around other people, like at parties, meetings, or public speaking. People with this disorder often worry about being judged, embarrassed, or humiliated in public. When someone has agoraphobia, they are afraid of situations from which they might not be able to escape easily, or without embarrassment. Some of these situations include crowded places, wide open spaces, and taking the bus. Number 2. Focus of fear. People who have social anxiety tend to focus their fear and anxiety on certain social situations and the people they interact with. Some patients worry about what other people will think of them, what they will say, or how they'll look in public. People with agoraphobia are afraid of a wider range of things, including the environment or situation itself. People who have agoraphobia might be afraid of having a panic attack or losing control in places where they think it will be hard to escape. Number 3. Behavioral responses. People who have social anxiety often avoid social situations or deal with them with significant distress. They might turn down invitations to events, feel very anxious before going out with other people, or even shut themselves off from everyone else. People with agoraphobia also avoid certain situations, but they do it because they think it will be hard to get out of them or because they are afraid of having a panic attack there. This can make them limit what they do and say at home because they think it is safer there. Number 4. The scope of the impact. Social anxiety mostly impacts a person's social life, relationships, and job prospects. It can make it harder for them to make friends and reach their goals. Agoraphobia can have a bigger effect because it makes it hard for people to do normal things outside of their home, like shopping or even going to work. This can significantly impact their independence and quality of life. Now, it is important to remember that these disorders can coexist, which makes things even harder for people who have them. This overlap can make diagnosis and treatment more difficult, which shows how important it is to get help from a professional. Therapy, medication, or a mix of the two are often used to treat both social anxiety and agoraphobia. Cognitive behavioral therapy, or CBT, is a treatment that is widely thought to work very well. Medications like selective serotonin reuptake inhibitors, think Zoloft or Paxil, can also help people deal with their symptoms. Getting professional help is the most important thing you can do to deal with these problems. No one should have to suffer alone. Talk to a therapist or psychiatrist who specializes in anxiety disorders to make a treatment plan that is right for you. Thanks for being here today. You've done something very important for your health or the health of someone you care about. Remember to stay strong and that a better future is coming. See you in the next video.